Hello, my name is Janie Ha, and today I'll be presenting a case study report of the 2009 H1N1 influenza pandemic surveillance and response efforts in the United States, focusing on New York City by the local public health department. So in 2009, the H1N1 influenza pandemic was the first reported widespread outbreak of this unique strain of the influenza virus. Over the course of 2.5 months, between April 24th to July 7th in New York City alone, there was almost 1,000 hospitalizations of reported cases. The Department of Health and Mental Hygiene in New York City had to rapidly expand capacity and intensify their active and passive surveillance methods in order to respond to the large-scale pandemic. In addition, they had to adapt to the changing conditions throughout the pandemic by updating the latest diagnostic and treatment recommendations, implementing an intensive vaccination program, and setting up community-based centers for uninsured to obtain needed care. The progression of the H1N1 pandemic started on April 15 in 2009, where the first case of the influenza was reported in California, and within days, additional cases were also reported in Texas and New York. A week later, on April 22nd, the CDC activated the Emergency Operations Center to release needed supplies from the Strategic National Stockpile and deployed National Incident Management System response teams to affected areas. The CDC also held formal press briefings on the very next day on April 23rd and alerting the mass public about the H1N1 as a nationwide concern. On April 25th, the World Health Organization declared H1N1 an international public health emergency and upgraded to global pandemic status on June 11th. It took over a year later for the World Health Organization to announce that the pandemic was ended on August 2010. And between April 2009 to April 2010, the CDC estimated that there were 43 to 89 million total H1N1 cases in the US alone, about 200,000 to 400,000 hospitalizations, and between 9,000 to 18,000 deaths. And the WHO estimated that over 280,000 deaths were reported in over 70 countries related to the pandemic. And focusing on our case study of the epidemiologic investigation performed by the New York City Department of Health and Mental Hygiene, the public health officials obtained surveillance data via active and passive reporting and also investigated reported outbreaks in schools, nursing facilities, and nursing homes in the area. A total of 57 New York City hospitals and 29,000 clinicians were surveyed, and they found that there were 996 H1N1 related hospitalizations in the first 10 weeks between April 24th to July 7th alone of the pandemic. And using US census data used for calculations, they estimated the pandemic rates to be about 12.3 per 100,000 New York City residents, with 95% confidence intervals. And in addition, they also found a statistically significant correlation between the higher rates of age-adjusted hospitalizations in high poverty versus low poverty neighborhoods. And in response to the pandemic, the New York City Department of Health and Mental Hygiene launched a comprehensive public health response. On April 25th, 2009, after preliminary lab results suggested the H1N1 outbreak, public health officials activated the incident command system and mobilized over 200 staff for large-scale response to investigate initial reports of local high school nursing home outbreaks and attempted phone interviews for all confirmed cases. Also, they established and expanded citywide surveillance by obtaining case information from 57 hospitals and 29,000 clinicians. And in addition, they launched an initiative to control, contain, and combat the epidemic by implementing an all-inclusive school-based vaccination program, establishing an advice hotlines staffed by nurses and set up community-based centers to distribute vaccines and medications for the uninsured. Regarding the communications of the event, throughout the pandemic, authorities address mass public communications through multiple channels. The CDC and the WHO responded immediately by declaring H1N1 as a nationwide international public health emergency. The CDC held multiple formal press conferences for media release regarding its plans to combat the pandemic to educate and reduce hysteria from the public, and also set up an easy-to-access 1-800 24-hour information hotline to address concerns from individuals. They disseminated information to health alert networks, partner organizations, and posted video and audio podcasts to the CDC website and also to social media channels such as Facebook, Twitter, and YouTube. I thought that the CDC and local public health departments was commendable for their rapid actions in declaring the H1N1 pandemic a public health emergency, and using creative multiple channels such as YouTube, Facebook, and Twitter, and also setting up a 24-hour hotline staffed by nurses in order to reach the public audience. In the end, almost 60 press conferences were held throughout the pandemic to address widespread public concerns and hysteria in the US. And in summary, the H1N1 influenza pandemic in 2009 caused widespread morbidity and mortality in over 70 countries. Both the CDC and WHO took rapid action and immediately declared concern for the pandemic as a public health emergency. The CDC partnered with local, state, and public health departments for a nationwide response and facilitated effective communication to the public via multiple channels. Key components of the emergency response plan include the expanded capacity and maintained flexibility to modify surveillance and monitoring protocols, adapting response and communication efforts to reach multiple populations by implementing school-based vaccination programs, setting up 24-hour advice hotline staffed by healthcare professionals, and posting video and podcast announcements via both traditional and social media methods. And last but not least, setting up community-based diagnostic treatment centers for underserved populations. Thank you very much for listening to my presentation, and here's a list of my references.